So let's discuss bariatric surgery in relationship to vitamin deficiencies. So many people are getting this surgery and seeing benefit with their diabetes. Now, why does it help diabetes? Well, there are two ways to increase insulin. One is by consuming a lot of carbohydrates, but the other is by consuming food in general, because every time you eat, you trigger insulin through a hormone in the small intestine called GIP, Gastric Inhibitory Peptide. So you trigger this hormone, which then increases insulin. So there's something in your small intestine that has the ability to trigger insulin, even if you're not consuming insulin. It's just food in general. So when they do surgery to your small intestine, you have a less ability to trigger insulin in general, and your insulin goes down. Now, is that healthy? On one hand, it's healthy because it's going to reduce insulin, but on the other, you're artificially altering that part of your body, and it comes with a package. Because now we have an altered digestive system that it's more difficult to fulfill the nutrient requirements, and we're going to have less absorptive surface of your digestive system to pull in those nutrients. The most common vitamin and mineral deficiencies with gastric bypass would be vitamin B1, B12, vitamin E, vitamin D, and copper. Okay, these are the most common, and then they can lead to all sorts of additional symptoms. This could be with your skin, heart, this could be bone pain, calcium metabolism, overall mood, immune system. This one could be neurological, so could this one. This one could relate to anemia. This one could relate to so many things, from energy to heart. So if you already had bariatric surgery, this is what I'm going to recommend. Nutritional yeast to get your B vitamins, okay? Trace minerals, not just copper, but all the trace minerals, like zinc, for example. Because a lot of times when they reduce the size of your stomach, you're not going to have the ability to absorb minerals in general, and definitely trace minerals. Now, vitamin D, you want to just get more sun or cod liver oil, very important. And also with the greens powder, concentrated high-quality greens powder, you can get not just your vitamin E, but you can get minerals, phytonutrients from that. So in other words, I'm recommending taking a concentrated food nutrient as compared to individual vitamins, and definitely synthetic vitamins. You want to avoid that. You also want to take apple cider vinegar, maybe through the day with some water, diluted, not by itself. You can sip it with a straw, but this is going to help the absorption of minerals, okay? And the other thing I'm going to highly recommend is intermittent fasting, because this will allow you to tap into your own fat more efficiently and also lower your nutrient requirements in general. The more intermittent fasting you do, the less nutrients you actually need, because your body starts recycling these minerals. Now, if you're considering bariatric surgery and you haven't done it yet, you may want to hold off and do healthy keto and intermittent fasting, because those two things together can greatly help someone with a slow metabolism. I had a guy who came to my last summit. He was 600 pounds, okay? He did not do bariatric surgery. He's down to 230 pounds right now, and he's doing great. I'll put a link down below for his story, but there is a way to do this without surgery. Thanks for watching. So if you're enjoying this content, go ahead and share it with someone that could really benefit from it.